I was lucky enough as a kid to grow up on the coast, basically grew up in Santa Barbara, California. And I got introduced when I was about 13, 14 to Dr. Purdy, youngest brother. We sit in the outfield shagging balls and was like, hey, you want to be friends? And so we became friends, and obviously I got to know his family, which comes from a couple lines of dentistry. Himself and his father got a lot more influence of like dentistry. So that's kind of how my initial invitation was into dentistry. When you can find your niche, it works. I went to undergrad at Cal Poly San Luis Obispo. And then after that, I took some time off, was able to live in Europe actually, in a place called San Sebastian, Spain. So I did that, came back home. I applied to a few dental schools and luckily enough got into UCSF in San Francisco, and I actually chose to stay in California at UCSF. And that took me to living in the Bay Area for about 10 years. I actually worked up in Marin and Mill Valley. And then Dr. Purdy had called me and being like, hey, you're gonna ever move back to Santa Barbara? And when he did, I kind of jumped at the opportunity. More kids miss school because of dental related issues nowadays than they did ever. You know, it's no longer like the common cold. It's basically because a toothache, your kid can't concentrate in school. Having kids go to basically a dentistry and just be checked out to make sure there is no cavities, underlying issues is huge. My biggest thing, it's always, to me, it's always been about the kids, getting them comfortable. It doesn't work. I'm not worried about what we see or what we can do right away. I want these kids to understand like this is a place that's going to help them in the future, not here to hurt them.